All right, I want to welcome everyone to the September 16th Virtual Trustee Forum. These virtual forums will give all members a chance to preview some of the agenda issues that our MDA board will be addressing in our formal board meeting next week. It offers everyone an opportunity to ask questions or raise concerns that might be helpful to the board when discussing these issues. Should you have a question or comment, please place them in the chat function and we will try to address all of them if we can this evening. Our panelists for this evening are myself, Dr. Michelle Jurgat, an MDA trustee, Dr. Eric Knudsen, Secretary Treasurer of the MDA, and Dr. Sherry Newman, an MDA trustee, as well as Ms. Karen Burgess, our Executive Director. So I'm going to start off with the first item on the agenda. So at each board meeting, I'm going to talk about what's called the generative discussion that we're going to have at the next board meeting. So at each board meeting, we normally have something called the generative discussion. We pick a topic to address through a roundtable discussion that we believe might facilitate a better association. For next week's discussion, we've selected a generative discussion on the topic of volunteerism. We want to examine not only how important it is, but how do you recruit volunteers? What makes a good volunteer? Are we training or orienting them adequately? Do they understand the expectations for volunteering? Do we or should we appraise volunteer performance? Are there members out there that might volunteer but just don't know how to get involved and aren't sure what it's going to entail? So these are some of the questions that we hope both the board as well as the MDA staff will help us address. And we're going to see what comes out of that discussion. Hopefully something that'll help us with volunteerism. All right. Next, we're going to hear from Dr. Sherry Newman, who's going to talk about dental licensure and the use of human subjects. Sherry.
Thank you, Mike. Hi, everyone. Happy to be here with you this evening to talk about this topic. A few weeks ago, the board held a special meeting to discuss the clinical licensure process and the use of human patients in that process. Presentations were made by representatives from the State Board of Dentistry, the American Board of Dental Examiners, the ADA Council on Licensure and Dental Education, the Joint Commission of Dental Examinations, the Wisconsin Dental Association, and Dean Aksu from Detroit Mercy, and also Dean McCulley from U of M. Dental licensure is intended to ensure that only qualified individuals are licensed to provide dental treatment to the public. But single encounter human examinations create a number of ethical concerns. There could be a real lack of follow-up in these situations. There's definitely a delay of treatment for sure. Unnecessary treatment of incipient caries can occur. And there's always the post-op concerns. What happens after that day of the exam and who takes care of that patient? There's also problems for the students. A lot of them have to pay their patients for the patients to show up. I know I did that. Students also can be held hostage by their patients for additional money. And we're also sending a message that we're using the patients for personal gain. And it's almost like they're a commodity to us. And that's just not what we want to convey to the public about dentistry. Fast forward now to the year 2017 and the development of the competent non-patient-based exam. The competent simulated tooth is not a plastic tooth, but it's a lifelike tooth with the same hardness and characteristics of a real tooth. The tooth mimics caries stickiness and tug back and can be restored as if it were a natural tooth. It's much better than using a live patient with small carious lesions, as it provides more variability and tests the judgments of the candidate, and it does reveal potential deficiencies. In April of 2020, ADEX approved the non-patient exam, and due to COVID-19, it was used in both the 2020 and the 2021 exams. This year, 95% of the students took a non-patient based exam. In 2018, the American Dental Association adopted the comprehensive policy on dental licensure, which supports the elimination of human patients in the clinical licensure examination. Next week, the Board of Trustees will examine this information and decide whether our association will also adopt a formal policy. Thank you.
Thank you, Sherry. Okay, next we're going to hear from our treasurer, Dr. Eric Knudsen. He's going to address the 2022 budget and the optional contributions on our due statement. So Eric, go ahead.
Thank you, Dr. Maherfer. The Committee on Finance met 3 times to finalize our 2022 budget draft, and it's looking good. We're returning back to norms after the 2021 and 2020 episodes with all the COVID and everything. Revenues and expenses are up 19% from the 2021 budget. The total revenues are going to be $7,146,704, and our total expenditures will be $7,146,408 for a net surplus of $296. So it's nice to be in the black. Dues and assessments will return to their 2020 levels at $550 for full dues and $295 for the special assessment. If everybody remembers, we basically shifted $100 from the special assessment to the full dues to help out with expenses in that year. Continuing education and governance meetings are budgeted to be live meetings, which is nice. We can't wait to get back in person. Administrative fees from the IFG were increased in 2021, and they will continue at that increased level for 2022. We appreciate all the work IFG does for the non-dues revenue. That's an important part of our budget with it. Endorsed program royalties have rebounded, and those are also budgeted for a small increase for the 2021 budget. Our MDA health plan sponsorship fees are tied to premium volume for the plan, so just a modest increase is anticipated. Salaries were budgeted to increase 3%, and the big thing that kind of took as much work as anything was our health insurance costs have increased up by 15% this year, which is kind of exceptional. Usually we've been averaging just about a 1.4% increase over the last few years, and so it was a little bigger jump, but historically we've done very well with that. The big thing with that is the annual dues will be $550. The special assessment will be $295 with it. A couple things that I'd like to thank Don Wynn and his staff and the finance committee as well as all the other MDA staff. They did a great job in compiling this budget. It's nice to finally have returned to a fully staffed finance department as well. That's a good thing for us. There was an email that went out earlier this week from me to the House of Delegates. I want to remind everyone that if they have any questions, to contact me by email or by phone. My cell phone is 906-399-0349. Thank you. That's with the budget. Second thing, we have some optional contributions, and I've got to switch papers here. The Committee on Finance met last week, and we reviewed these optional items that are optional contributions that are on our dues statement. MDA Foundation will remain at $65. The PAC contribution will remain at $65. AdPAC's contribution is going to go up a little bit. It's going to increase to $65. The third thing that only Washtenaw District members will see, there will be a $50 line item on there for to support their scholarship fund. And those were the optional items. And that's all I have. Thank you.
Great, Eric. Thanks for doing that. Really appreciate that. Next, we're going to discuss some of the legislative priorities that are going to be discussed at the upcoming board meeting. And Dr. Sherry Newman is going to discuss the first one, and it has to do with a bill regarding permanent revocation of licensure for criminal sexual conduct. So Sherry, can you explain that to us a little bit?
Thanks, Mike. The background on the two House bills number 4857 and 4858, they are tie-barred, meaning that if one passes, the other one has to pass. And they would require permanent revocation of licensure or registration of a person convicted of sexual conduct under the pretext of medical treatment. This does include dental professionals, and these bills do have bipartisan support. So taking the first bill, which is number 4857, it states that any conduct by a health professional with the patient while he or she is acting within the health profession for which he or she is licensed or registered, including conduct initiated by a patient or to which the patient consents, that is sexual or may reasonably be interpreted as sexual, including but not limited to sexual intercourse, kissing in a sexual manner, or touching of a body part for any other purpose than the appropriate examination, treatment, or comfort. Offering to provide practice-related services such as drugs in exchange for sexual favors. So the second bill, which is 4858, actually lists all the different scenarios, but basically states for us as dentists, a disciplinary subcommittee would impose one or more of the following sanctions. And in our case, it would be the revocation of licensure or registration of a person convicted of that sexual conduct. So the resolution that will go before the board next week states that the Michigan Dental Association supports House Bills 4857 and 4858 regarding the permanent revocation of licensure or registration of a person convicted of sexual conduct under the pretext of medical treatment. So that is what we will be discussing and voting on next week. Thank you.
Okay, thank you, Sherry. We're now going to have Dr. Michelle Jurgak speak about two of the other bills that we're looking at next week. One is the Dental Vision Bill, SB 543, and another bill regarding adults accompanying a minor, SB 404. So Michelle, whenever you're set, you can go ahead and explain those. Thank you.
All right, so the first bill is Dental Vision. It amends the Nonprofit Dental Care Corporations Act, which this is the law that enables Delta Dental of Michigan. This bill would allow nonprofit dental care corporations to also provide vision insurance. Delta is currently the only nonprofit dental care corporation in Michigan. Delta is indicating that employers are requesting Delta to provide vision coverage. The Michigan Optometric Association is neutral on the bill, and the MDA's Committee on Government and Insurance Affairs recommends to the board that the MDA be neutral on the bill. Our second bill is for adults accompanying a minor. This bill would prevent medical facilities, which includes dental offices, from having policies that do not allow a parent, guardian, or other individual to accompany a minor or an adult with a developmental disability, which is very common in pediatric offices. The MDA EC reviewed this bill in May by a request from Senator Lana, Theis? The EC decided the MDA could support the bill if an exception was added that an office could prohibit a parent guardian from accompanying the minor if the presence of that parent or guardian would be a hindrance to care. The Committee on Government and Insurance Affairs recommends the MDA oppose the bill.
All right. Thank you. Thank you, Michelle.
Thank you.
Okay, great job. Next, we're going to hear from our Executive Director, Karen Burgess, who's going to give an update on our MDA strategic planning. Karen?
Thanks, Mike. So just to let you know, of course, we adopted a new strategic plan in December of last year. And as an overview, the 21 to 25 strategic plan has 5 goals, 9 objectives, and 18 strategies, which seems like a lot, but they're not all going to get done this month. As a reminder, the goals are to define and deliver exceptional member value, to engage and develop relationships with members and leaders, to ensure organizational sustainability, to understand and improve diversity, equity, and inclusion at all levels, and to advocate effectively for the dental profession and the public's oral health. So when we get to Benton Harbor for our board meeting next week, the board will be hearing an update and receiving some details about forward progress on our strategic plan. And just to give you a quick kind of recap of what kind of progress they'll be learning about, and any board members who are on this call are getting a sneak peek of that. In support of the goal of member value, we're going to be giving details about a member survey of all our active members that are going out. The survey has two purposes. One is to take a snapshot of how our members feel about the value of MBA membership, and it will also give us an opportunity to evaluate specific products and services that the MBA offers. It is actually going out next week to all active members, as I said, and a really great thing to note is that this time the ADA is helping us with this survey. So that means we're going to have a much more professional platform for the online survey, which will give us greater ability to analyze the information that comes in. Angie Kanazi, our membership director, is the team leader for this goal. And in support of the goal regarding MBA member engagement, we're evaluating different software options to allow us to do greater data analysis about you as the member all across the different data silos within the Michigan Dental Association and the IFG. And that's going to give us a better way of looking at how our members are engaging with us really one at a time. That'll allow us to identify areas where we could improve in order to do a better job of encouraging participation in all the different activities, products, services, initiatives, and things like that that the MBA offers. Rich Evans, who is our new marketing and communications director, has taken over as team leader for this goal after our loss of Jenny Armstead to the financial services industry. Goal 3, as you might recall, is to ensure organizational sustainability. And in support of that goal, we're going to be looking at non-dues revenue sources. So there is a part of our survey for Goal 1 that is going to help us do that. And we do plan to use a very robust approach that is outlined in the current edition of Race for Relevance. Our expectation is that we're going to be able to focus on the resources for members that bring the most value to our membership. So CFO Don Wynn is the team leader for that goal. The fourth goal, I know you all have been reading in our journal about diversity, equity, and inclusion. And we have made a lot of progress in a very short period of time on diversity, equity, and inclusion, both in terms of collaborating with diverse dental organizations in our state to begin some collaborative projects to increase the diversity of the dental profession here in Michigan. We also established a new committee on diversity, equity, and inclusion, and I'm going to tell you that they are on fire. They really are bringing a lot of value. Dr. Mayhofer worked very hard to identify and bring on people who are going to be enthusiastic and committed, and we're really seeing that. So most recently, the committee met with editor Chris Smiley and managing editor Dave Foe to take a look at our journal, how decisions are made about what goes into the journal, and then also to provide some feedback and suggestions. And my understanding was it was a great discussion, very, very productive. And then finally, our goal on advocacy. We have seen a lot of forward progress here as well. We have a strategy of increasing component involvement in legislative activities. So we are reporting to the board that 5 components have already held legislative events and 5 more are coming up in the weeks ahead. We'd like to involve more grassroots members in meetings with legislators. So we have been reporting that there have been 7 meetings held already with member dentists, and 14 more are on the books. You know, with term limits, we have the challenge that very frequently a whole boatload of new legislators come into the process. And that means that the MDA has to bring a whole lot of new people up to speed on dentistry, dental issues, and that kind of thing. So we have a strategy of onboarding and educating new legislators. And as you know, we had a lot of new legislators begin at the beginning of the year. So we had already held 31 meetings with newly elected key legislators so far this year. And finally, one of the things that we found out was that a lot of our advocacy initiatives and a lot of the work that happens kind of like an iceberg. Most of it is below sea level, meaning you as a member don't see it. So we have an initiative to increase awareness of our advocacy initiatives and also increase our satisfaction with MDA over advocacy overall. Excuse me. So we've put together a member communications plan, and the board is going to hear more about the specifics of the plan, including a new fun approach to video, as well as more proactive and frequent communications. So that is all the news that's fit to print about the strategic plan. Thank you, Dr. Mayhofer, for the opportunity to update the folks.
Okay. Well, thank you, Karen, and thank all the panelists. Do we have any questions from those of you that are out watching? You can put them in the chat if you want, and we can call on you if you want to say something or share a comment or if you have a question.
We have one of our attendees in the Q&A who said, "Thank you for making these updates virtual." You're welcome, Alexa.
Yes, we're finding that Zoom has been a great boom to all associations, but especially to ours. And we've noticed that a lot of our committees now have chosen to meet by Zoom, and we're finding that they get bigger quorums or better quorums or more participants when it's on Zoom. So that's been a great new tool for volunteers who serve on committees at the MDA, and something that's probably going to be around from now to forever. So we are utilizing electronics. Does anybody else have any questions about anything that we discussed tonight or want to make any comments or anything? All right. Not seeing any. I want to thank all of you for spending a little bit of time with us tonight as we previewed next Thursday and Friday's board meeting in Benton Harbor. And I guess we'll all see you next time. So thanks again.